Hi everyone and welcome to today's webinar, Streamline with Accurate Scribe, a smarter way to work in primary care. Thank you so much for joining us today. My name is Kate and I'm an implementation lead here at Accurux. I'll be leading today's session, introducing you to Accurate Scribe powered by Tandem. We're very excited to introduce you to this powerful new tool, which has been designed to make your work in general practice smarter and more efficient. A little bit of housekeeping before we begin. I'm just going to give a quick overview of what we'll cover today. So I'll start off with introducing Accurate Scribe and what this means for you in general practice. I'll then hand over to our guest speaker, Dr. Faris Al-Ramadani, who's going to speak through his experiences introducing an AI scribe into his practice and talk about his journey so far. So we're really excited to have Dr. Faris with us today, and thank him so much for joining. I'll then give a short demo and there will be plenty of time for questions. So please do use the Q&A function to ask questions throughout. I'm also joined by some of the wonderful Accurux team who will be answering your questions throughout the session. There will be time at the end to answer some live as well. So if you have specific questions for Dr. Faris, then don't worry, we should hopefully have time to get to these towards the end of the session. This session is also being recorded and everyone who registered will receive the recording afterwards in a follow-up email. So don't worry if you need to drop off for any reason or you know of colleagues who were unable to join, they will receive this recording in the follow-up. Finally, there are a few QR codes shared throughout the session. So if possible, just make sure that you have a device on hand to be able to access these. Don't worry too much if you do not have a device able to scan QR codes available. We can share some of these links in the Q&A chat box and then also in the follow-up as well. But just to warn you, there are a couple of QR codes. So let's begin by first of all introducing you to what Accurate Scribe powered by Tandem actually is. Accurate Scribe is an AI-powered scribe solution designed to reduce the administrative burden of clinical documentation. It automatically generates clinical notes by listening to patient consultations or reviewing clinician dictations. So as you can see on the screen here, we have the lovely, very familiar Accurux toolbar. When you do get access to Accurate Scribe, it will appear as a new icon on the toolbar where you can see this mic icon. So let's talk about the challenge we're trying to solve here. Each week, a significant amount of staff time is lost simply to typing and note-taking. It's something that doesn't directly improve care, but is absolutely essential. So there's detailed patient notes, captured and coded properly, and this can happen around 25 times a day per clinician. And that's then on top of all of the other admin and operational pressures teams are dealing with. NHS-wide, it's actually been estimated that staff spend nearly a third of their day every day on administrative work. So for clinicians, this adds up to around a third of their entire week. And that time could otherwise go toward patient care or recovery from an already very demanding job. The problem isn't just the time, it's when the admin actually gets done as well. So a lot of it happens between appointments or after hours, chipping away at personal time and contributing to burnout. I'm sure lots of people on this call today can attest to that. When a clinician is focused on writing accurate, detailed notes, it inevitably splits their attention, taking away from the most important part of the appointment, which is actually engaging with the patient. And I know Dr. Faris is going to speak to this slightly later on as well, in terms of his experience since implementing an AI scribe tool. And even when those notes are captured, system-wide communication is still a real challenge. So outdated processes and inconsistent data entry continue to hold back integration across the NHS. Again, I'm sure lots of people on the call are very familiar with those difficult systems, outdated systems and human error that can lead to difficulties. So imagine the impact if we could actually reduce that burden, not just for efficiency, but for well-being, job satisfaction, and ultimately better patient care. Enter Accurate Scribe. So let's talk about why Scribe is such a game changer. Accurate Scribe uses AI to capture, code, save, and share structured clinical notes and documents from consultations and free dictation. It's built to be effective, safe, and fully assured, giving clinicians confidence in the accuracy and security of their documentation. Also integrated with your clinical systems, there's no disruption to your workflow. And just like all Accurux features, Scribe is easy to learn and simple to use. You'll also get free training and ongoing support from our dedicated Accurx team, so you're never left alone throughout this. I will come to this slightly later on when I talk to some of the resources and support that's available to you once you get access to Accurx Scribe. So just to call out a few of our benefits before I hand over to Dr. Faris, who's going to speak about his experience. First of all, saving time by skipping the typing with perfectly structured details. So clinicians can save hours per week by using Scribe to generate those comprehensive, structured and coded consultation summaries and documentation. This means a shift from writing to reviewing, and then from out of hours admin, as we just discussed, to actually just really quick click task completion. Scribe will automatically generate those consultation notes, and I'll show you this in more detail when we come to a demo in a moment. It can create downstream documentation as well to your chosen style. Again, I will come to this. You have easy template switching, and you're also able to change the template once you created the note if you have made a mistake in terms of the template that you have selected. Saving to EMIS and System 1 with one click. And then also, as you've mentioned, saving hours per week, reducing stress and reducing burnout. Accurx Scribe will listen so that your patients are heard. So I've touched on this already, but it allows you to kind of like really liberate clinicians from time spent typing, meaning a better interaction experience for practice staff like yourselves and then your patients as well. So clinicians can feel assured knowing that Accurx Scribe is handling the notes without distraction of EMR multitasking, and you'll have far more headspace for patients and not the paperwork. So with Accurx Scribe, you're really capturing the details in comprehensive notes, and you can give patients your full attention, obviously better experience for both patient and clinician. You're producing consultation notes in front of you, ready for your review. So we'll see in a second just how smart it is in the way that it will kind of record your voice, pick up that consultation, and then you're able to generate that note and see that note really quickly in front of you for your review. And then finally, saving to record with one click. Another really exciting one is just being able to connect your voice by integrating with patient records and Accurx messaging. So something that's really unique to Accurx Scribe. The speed and time-saving benefits of Accurx Scribe are multiplied by its integration with our two-way patient messaging and cross-NHS communications, which you may already be fairly familiar with. You can empower patients by sharing consultation summaries with them instantly, and then also transform that cross-NHS data and documentation sharing by using pathway-specific templates in conjunction with Acumail, which you have available to you on your toolbar as part of our Accurx Lite package. Finally, another very exciting announcement. I wanted to introduce you all to Accurx Mobile. So we're not just launching a Scribe tool, we're actually also launching Accurx Mobile, a mobile app. From June, we will begin rolling out Accurx Mobile, which is putting a version of Accurx in your pocket. The Accurx mobile app will give you access to 3 Accurx features on the go. So this is going to be Accurx Scribe, patient messaging, and then your Accurx inbox as well. So Accurx Scribe in the Accurx app will turn your phone into a high quality microphone, which can be used in your consultation rooms if you don't have access to a high quality microphone. Also on the go with patients, such as with home visits, if you wanted to. So once recorded on the phone, it is then ready for your review on your computer, where you can make edits, save to record, and generate documents from your transcription. So heaps of benefits there. If you do have any questions, obviously, about any of this, then feel free to just ask away in the Q&A, and we will answer them towards the end as well. But without further ado, I'm now delighted to introduce you to an early user and true Scribe champion, Dr. Faris Al-Ramadani. So Dr. Faris is a GP partner at St Wolfston Surgery and one of the highest rated practices in England, and also winner of the 2024 HSJ Primary Care Provider of the Year Award. Dr. Faris is here to share how the use of an AI scribe powered by Tandem has changed his day-to-day consulting, giving him the breathing room to listen more closely, write less, and practice medicine in the way he was trained to, really focus on the patient and not on the keyboard. So obviously what we've just previously been speaking about. Without further ado, please join me in welcoming Dr. Faris Al-Ramadani as he shares his story. Thank you so much for joining us, Faris.
Hi, thanks, Kate. Thanks for having me. Yeah, so our journey really with an ambient AI scribe started several months ago, and really the logic for using an AI scribe was pretty solid. From a patient's perspective, I mean, we're always looking for solutions that are going to improve the patient experience, the quality of care we deliver, but also improve the GP satisfaction, work satisfaction. And it really is always good to try and identify technology solutions that really free GPs up to be GPs, clinicians to be clinicians. And as you said before, Kate, a third of our time is spent doing administrative function. And that's something we gain very little pleasure or satisfaction from doing. So the scribe had that benefit of helping both the patient and the clinician as well. So we gave it a try, and it's been really, really interesting actually, because I think a lot of what you said there in terms of the perceived benefits of using the scribe have actually been realized. I think we've gained some data and gathered some data from patients and clinicians to try and understand whether these gains are real or not. And I can say from what we've done so far, yes, these do look like very real gains. So from my personal perspective of using the scribe, I mean, we deployed it across the surgery, so all clinicians had access to use the scribe. Some used it, some didn't use it, which is completely fair enough, because just because someone enjoys or gains benefit from using it, it doesn't mean everybody will. And some people don't necessarily feel in the position, that they want to use that sort of tool at the moment, which is completely fine. So we deployed it on a surgery-wide basis, spoke to our patient participation group as well about deploying the solution, and got going with it. From a clinical perspective, the first thing that we do is consent the patient. So when the patient comes in the consultant room, we consent them, make sure that they're happy for us to use an AI scribe. I'll often point to the microphone and say, look, I've got this device. It's listening to our conversation. It's going to turn what we say into the text that goes into your medical record, which means I can pay more attention to you and less time to my computer screen or keyboard. Inevitably they all like that. So I've not had a single patient say that they're unhappy with that approach, and actually you get lots of positive comments about, wow, it's great that you're using technology. So that's often seen and perceived quite positively, I think, from patients. We haven't in our experience had one single patient unhappy or uncomfortable with using that tool, which is really good. The great thing with this tool is the integration. So the integration into Accurx means that this is really quick and easy to use. And I think what I've learned is I've probably done several hundred consultations, more than that even, like lots of hundreds of consultations now with the scribe. And it would be misleading to say, plug it in, get going, and you'll be absolutely fine and you'll reap the benefits immediately. It doesn't quite work like that. There is a learning curve. There is some patience that's needed at the start to try and understand, how does this tool really work? Get used to talking to patients about the observations, about what you're seeing. For example, the scribe is able to SNOMED code observations, really neat, really tidy, but you have to tell it. So it's very unusual for me to examine a patient, do the temperature, and tell the patient what their temperature is. And if I don't verbalize it, it doesn't go in the record. So now I've actually got used to telling the patient everything I'm experiencing or finding, even in examination. So if it's an abdominal examination, I'll tell them the results of that abdominal examination. It's definitely better for the patient, and actually it's good practice, I think. So that's forced me to do something that I think has definitely improved another aspect of the consultation. But the really obvious thing is I can listen now. And it's actually switching from that position where consultations every 10 minutes were becoming, and I'm sure there's lots of experienced GPs out there that will feel this, more, the consultations became quite transactional. It was about the patient coming in, finding out what we needed to know as quick as possible, as efficiently as possible, so we could help that patient as directly as we could. And actually, you lose a bit of yourself in that consultation when you are becoming really transactional. Now I don't have to write the notes and concentrate on the screen. I really can concentrate on the patient. What I found initially actually was the consultations were actually taking me a little bit longer because I was really much more present in that consultation. I was listening more at what they were saying. We were having much more of a free-flowing conversation and dialogue. So actually I switched. I thought this would be quicker, but actually my consultation went a little bit longer. So then I realized that was happening, and then I've managed to just make that a little bit tighter, so that it doesn't, so that I can bring it back into a good time frame. So it's really satisfying that I can feel more present in those consultations. I feel like I'm giving more to the patient. I'm having to explain everything I do, including the management plan, including examination findings, which I think is giving the patient a better experience as well. And then the beauty of this, and people are going to love this, once you've finished, It sticks all of the notes that you've gathered through that consultation into the clinical record. And if this is a patient that I need to refer into hospital or refer to an outpatient clinic, within 2 clicks, it can convert that text into a template, which can then serve as the referral letter. So that is a huge time saving. So the two together means that there's a real significant benefit time-wise. And it removes a part of the job that was just boring. It was just repetitive, and it took my focus away from the patient. So the overall benefit from a consultation perspective is, overwhelmingly positive. I think there's going to be some caveats as well that I probably need to say. So first of all, don't expect that the scribe is just going to give you a 100% perfectly produced note that you can save and move on. So I would say don't expect that, and don't be complacent. It's still really important, once the scribe's done its job, that you go through, review the note, make sure that you're happy with the content. You will surprise yourself that there will be things in there that you thought the patient said, but you forgot, and actually it's in there. So that's quite nice. But it's really important to make sure that you're happy with the details that have gone into that note and that they are accurate. So really important to do that. And I find that most consultations, I will still tweak that note. And I don't feel that's a bad thing. It means I've summarized it, I've looked at it, a few tweaks here or there. But actually what I feel like is that the scribe has done the heavy lifting, right? And I'm just finessing the little detail at the end. So the 80-90% of the bulk is done, and I'm just finessing that last 10% of the consultation note. So I'm happy, comfortable, and it's saved in the record. So all that works really, really well, and definitely saves some time. I think the things that we've found are, probably the other thing I should say is, some consultations you'll find that this works really well in, and some maybe not so. So for example, if I'm doing joint injections, I may not use the scribe. I may just get on with that, because that's a very practical thing to do. So you might figure out what sort of consultations this gives you the greatest benefit and find that those are the ones you're going to use it for. You might find there's a different type of consultation and you don't want to use it for that. So there is definitely a period of time that will be several weeks of trying to figure out the right scenarios and right situations. It will also, be that learning period about how do you get your consultation into the right period of time, and you don't let your mind wander and you don't start talking too much. So you be expecting that. Be expecting that there will be some time taken to do that. One thing that I think is great is it feels like I can now consult in the way that we were trained to do, because we were trained before to consult in a certain way. But actually, once you start working, and once you've got the complexities of having to put the notes in, doing your lab forms, doing other things, actually, you have something gives. But this gives an opportunity to come back to sort of that purity of the consultation method, right? Being able to concentrate on the patient and be present in the moment. So that's a really amazing thing to be able to offer. So I think that's probably a reasonable overview of how we found it and how that's gone. And I think probably the next thing to tell you is about what we've experienced in terms of the feedback that we've got. So the learning that we've had is, from a patient side, it does appear that patients feel aware that the GP is more present in the consultation. It does seem like patients are aware that the GP is concentrating more in that consultation. And patients seem to be much clearer on what the management plan was and what the expectations were at the end of the consultation. That was quite an overwhelming difference between the consultations where the scribe is used and where it wasn't used. Patients seem to be much more aware of the plan. And I think that's really interesting. And I think that probably comes out of the fact that as the clinician with the scribe, we are talking all the time to the patient. We are relaying that information. We're not typing and forgetting to say, literally we're verbalizing everything. And I think that's got a huge benefit in terms of the empowerment of patients, empowering them to take more responsibility for their own care. And this also translates to a benefit when all patients now have online access to their record, so they can see these consultations with a full narrative in their record, which is much easier for them to read and understand. So I think from a patient empowerment perspective, this is a great bonus. From the GP's perspective, the data that we've seen has suggested that screen time during the consultation has reduced, whereas most GPs said about 40% of their time with the patient was spent looking at a screen. That's now dropped to less than 20%. So it was definitely a clear shift. And in terms of time saved, the average amount of time people are spending when they use the scribe is less than a minute on writing the notes, whereas before it was somewhere in the region of 3 to 4 minutes. So if you assume, this is where it gets interesting, if you assume that you save 2 minutes per face-to-face consultation on saving your notes, and you see, say, 18 patients per clinic, and let's say you work 6 sessions per week, the scary number is that equates to 135 hours per year. Now, you're not suddenly going to realize 135 hours and be able to do 135 hours of something else, but it gives you a feeling for actually how much of a release valve, a pressure release valve this is in terms of a GP's working life and, reducing some of that burden. So those are probably the sort of key headlines that GPs have noticed. And definitely the feedback, again, we've had is that GPs do feel sort of more present in those consultations. So that's a reasonable summary, I think, of where we're up to. And the journey's ongoing, the learning's ongoing, and I think it will be the same for everybody. You'll keep learning how to use this tool best, in what scenarios it works best. The fact that you won't need to be writing referral letters is another massive boon as well. So, I hope that was helpful.
Really helpful. Thank you so much for joining and kind of speaking about your experience so openly. Really useful to kind of see how that's transformed, and especially the data pieces in there as well, how that's really transformed your day to day. Putting you on the spot here, but just a question from my side. If you were to give one piece of advice for practices that are looking to, start using Accurate Scribe, what would you say?
Oh, okay. Could I break it down into maybe the practice and the GP, right? So,
Please do.
so for practices, always look for the technological innovations that are going to help your patients and help you deliver better care to your patients and help empower your patients, but also those that are going to help you, help your GPs, help their quality of work, help their work experience, help reduce the burden of their admin. And if you find a solution that does both, then it's a good solution. And this is one of those. So my message to GP surgeries would be, actually, this is a solution that could resonate with benefiting both parties. But for the clinician, to be honest, I think the thing I would say is patience, to be honest. You don't expect that you'll turn this on and you'll run with it and it will be absolutely perfect. Just as when we trained to be GPs, we had to be incredibly patient, see lots of patients, try and understand the right way to consult with patients, go through lots of assessments so that we consulted as well as we could possibly consult. We used a lot of patience to get to where we are at the moment as qualified GPs. Well, the same sort of patience needs to be applied to this tool. It will take some time to figure out the impact it has on your consultations, how it changes the way that you work, try and figure out the areas at which it saves you time, but the time saving won't necessarily all be at the start. So for me, the piece of advice would just be patient with it, get going with it, give it at least a few weeks, give it at least a couple of 100 consultations before you get to the point where you feel like, I know how this works, I know where it's going to save me time.
Amazing. Thank you again so much for sharing your experience. Dr. Faris will be staying on the call, as I mentioned. So if you have any specific questions for him, then please do pop them into the Q&A and we will answer them in a moment. I'm just going to take us through a demo, first of all, so you can see what this actually looks like in practice. So bear with me while I just share my full screen. So you should now be able to see my entire screen. I have my clinical system open, a patient open. We have Julie Adams open today, and then my Accurix toolbar floating in the front here. Just before I begin, I just want to note that the steps are exactly the same, whether or not you use EMIS or System 1. So don't be alarmed that I'm using EMIS today. This will be exactly the same functionality for System 1 practices. As we saw earlier, the new scribe icon is going to appear on your toolbar. And if you hover over it, you'll be able to see that this says Accurate Scribe. Before I click into it, I just want to note that when you access Scribe for the first time in your organization or your practice, you will be asked to accept new terms and conditions and also accept the new DPA. So a new page will appear, a pop-up will appear in product to ask you to read through that information and then accept the new terms and conditions in DPA before you can enable full access and start scribing, essentially. There will be some support links in there as well if you want to see that checklist that I've spoken about in terms of kind of the compliance and governance that you will need to do ahead of getting started. So once you've done so, you'll be able to then click into Scribe and it will open up Accurate Scribe powered by Tandem in a web browser in WebView. As my practice has already accepted those terms and conditions in DPA, I won't be asked to do that again. This will only happen once. Clicking into Accurate Scribe, then I am presented with the wonderful home screen of Accurate Scribe powered by Tandem. As you can see, it's nice and clean and really easy to navigate. We have a welcome message saying hello, Kate, and then a big blue start button, which is where you would begin to start a new consultation. I'm going to come back to that in a moment. First of all, I just want to show you our settings. So our encounter settings sit at the bottom here. This is where you can basically set up for your new consultation. The first setting here is just to determine whether or not we want to let Tandem listen in and create the note for us in a new consultation, or dictate directly into an empty template using Smart Dictation. For the purpose of this demo, I'm going to use consultation, but you'd use this drop down to just flick between the two. We then have templates. So I've spoken briefly to this already. There are a number of templates available in your system that you can select from. Don't worry if you selected the wrong one and you've done your consultation, you can change this retrospectively, but you do have this option to set up prior to starting the new consultation. So for the purpose of this, I'm going to be using the Accurix GP Notes. And then finally, we have the microphone set up here. So currently I have remote audio, just using my desktop audio for the purpose of this. If I had an internal mic enabled, then that would appear in my drop down and you'd be able to select that and then also test before you start beginning your consultation. If I go ahead and then click start, you'll notice that Accurate Scribe powered by Tandem is now going to start listening to everything that I'm saying. Note here that it is not recording and storing a recording of the consultation. It's purely now just transcribing and picking up the audio of what I am talking about. You'll also note in a moment that it won't be picking up all of the kind of clinically irrelevant information that I'm talking about. So currently, I'm not saying anything that's actually of use for the consultation or for the note that we're about to generate. I'm purely just talking normally, and it won't be picking up any of this and saving that into the note. You can pause at any time, hitting that pause button, and then resume the encounter if you want to by hitting resume once again. Once you're happy with your note, you just want to go down here and select finish and create note, and then you'll watch it generate and kind of populate in the structure that you've asked it to in front of you. Now, in true Blue Peter fashion, I am going to open up one that I did earlier. This is an output from Scribe based on a consultation that was run earlier on. So you can see here, based on that template that we have given it, it's broken down into these different sections. So we have the history that was discussed during the consultation. We have a brief examination. We have some coded observations. And please note that these are coded to the record. So currently we are able to code observations into your record, and then down the line we will be releasing further SNOMED coding to support with QoF, for instance. So this will be coming over the next few months. There's also a social aspect in here with the patient smoking approximately 1 packet of cigarettes per day, and then a comment where we have given a plan for the patient's kind of treatment. Rest at home, contact clinic if no improvement. First thing to note here is it's the clinician's responsibility to review this information. So I've touched on it briefly already, but it's really important that whoever is conducting that consultation it is reviewing the information for accuracy and the detail needed before going ahead and then saving that to the patient's record. Faris touched on it in kind of his part, but he obviously mentioned that he would then go in and edit some of these parts of the template before saving it to record, either adding in some further detail, whatever you deem needs to be added in there, then you can do so retrospectively once it's been generated. So there are a number of ways that you can do that. We can type directly into any of these boxes. If I wanted to, I could just start typing, and then that would save the new history as we've added with the information that we've added in. You can also dictate directly into the field. So I can do so using this dictate function, 1, 2, 3, 4. And you'll notice that that has now populated the history once again with the further information that we have added. A really nice function is the ability to add or adjust by giving some automatic adjustments and dictating into this box again. So using this kind of smart edit function, then you can add in any further clinically relevant information and also determine where in the template it goes. So for the purpose of this, I'm going to just give an example here. For this patient, change their past medical history to include type 2 diabetes and change their medication history to include metformin 500 milligrams. Add an allergy section, which includes penicillin. I can stop that, and then I can save that into the template. It's going to update my note. And you'll notice here that we now have past medical history noted with type 2 diabetes and medications noted metformin 500 milligrams. Further down here, it's also added an allergy to penicillin. To go one step further, if we want to be particular about the structure here, I could actually dictate and ask it to put the history into bullet points if I wanted to. Put the history into bullet points. And there we go. It's now structured it into bullet points, which is far easier for us to read. I've touched on it already, but just to flag that the ability to switch between templates sits down here. So if you wanted to generate a new note based on a different template, then you could select one from this dropdown. You can add in a blank entry if you wanted to. So I could add in further SNOMED coded observations with body weight, standing height, etc. in here. And then we just spoke about the add or adjust function. Your transcription sits on the left here. And then you also have the ability to create other documents based on the information within that note. So if I wanted to, I could utilize any of these downstream documents to then generate a document to share elsewhere. So for instance, you might want to share a text message using our two-way messaging that you have available to you on your Accurx toolbar retrospectively once you've had that consultation. So you can use the Accurx SMS template here to populate just a brief summary of what's happened in that consultation to share with the patient, along with the advice given to avoid penicillin due to your allergy and rest at home. What we could also do here is create further documents. I might want to add in a specialist referral letter to then be sent outside of my organisation to another service potentially. So you can see it populate in here. We have the diagnosis and clinical question. We also have the requested action. And then finally, the medical history and findings, along with a signature that's pulling from my user. So what you can do is copy the information in here, and then you can pop that into Acumail by navigating to your @ symbol and then send that to the appropriate person outside of your organization where you want to flag this referral. Couple of other bits to flag then. We do have this speech to text function, so you're able to speak freely and create text to then copy elsewhere. So I could dictate directly into this box if I wanted to, and it doesn't necessarily need to be that clinically relevant information. So I could just start talking in here, and it's going to pick up what I'm talking about. And then when you hit stop, you're able to then copy that information and put it elsewhere. I also just want to show the settings. So navigating to the settings, you have the ability to amend a couple of settings to do with your consultation or your dictation. By default, brief assessment and plan is toggled on. So if you don't want to have a brief assessment and plan generated when you do generate that note, then do just utilize this toggle here to switch that off. You also have access to a spell check, displaying the language, and this is where the language that you want to see your interface in, and then a guided tutorial as well that you can always refer back to if for any new starters, or when you do first get started. I definitely recommend having a look at that guided tutorial that you can initiate at any point in time. Finally, we also have the microphone setup. So alongside, you obviously have it in your encounter settings that run at the bottom of the screen. You can come in here and change that microphone setup. Just to flag as well then the dot phrases that we have available. So you'll see down here that I have a dot phrase already created. We've spoke about consent briefly already, but what you might want to do when you start a consultation is just to obtain consent from that patient. So briefly just state to them that you're going to be using a scribe tool, and do they consent to it being used, rather than you having to type into the note every single time patient consented to use Accurate Scribe. You could add that phrase in as a quick phrase here, and then when you go back to your consultation, if I navigate back here, what I can actually do is then add in that quick phrase just by using a semicolon, and you'll see that it's populated patient consented to use Accurate Scribe for me already. Now that I'm happy with all of that, I've reviewed my notes. I know that the relevant detail is in there, and I deem it ready to be saved to record, then I can save directly to the patient's record in one click. So if I just minimize that there, you'll be able to see my patient's record behind. I'm going to hit save to record here. You'll notice that the confirmation of the patient that's open in my clinical system is displayed on screen. So I'm just confirming that this is the correct patient. I can see the patient's details, and then hitting save to record. We will now be able to see that save as a new consultation in Julie Adams's record in EMIS behind. So really quickly there, it's now just saved the patient's record. And what I can do here is just show you the structure of that in EMIS as a new consultation. So we can see the history, the examination, including those observations coded to record, the comment that's been given, the allergy that we added in, and then finally that the patient smokes approximately one packet of cigarettes per day. I'm going to leave that there and come back to the deck so we can just run through some best practice. So a few bits of best practice that I just want to share before we move on to the Q&A. First of all, the essentials for making really good notes. So do check your audio. Make sure you have good audio. You're using a reliable conference microphone, or once we have access to Accurix Mobile, please do make sure that you're using that, as that will also give you a really good quality microphone for use in your consultations. Appropriate template. So I've mentioned this, but just ensure you selected the template that includes all the information you want to document. Remember that you can alter this once you've generated your note if needs be. And then giving it clear instructions. So really provide Scribe with precise keywords and concise summaries so that it will basically give you a really accurate note at the end of it. Please note that Scribe isn't transcribing word for word. As we saw there, it isn't picking up any of that clinically irrelevant information that I was talking about. Instead, it's going to organize what you say under those predefined headings in that template that you have selected. So before your consultation, do test your microphone connection to ensure the recording is working. Run a test consult with a dummy patient, note any observations, measurements, and any key care points, and then provide context as well. So briefly explain to Scribe what is already known about the patient and what has been discussed previously. This helps ensure relevant details are categorized correctly. During that consultation, inform the patient you're using Scribe and record consent. So we saw there those dot phrases, utilize that to record consent into that note. A really important one is to just clearly narrate any clinical actions and state your assessment out loud. So Scribe will only include information that is explicitly expressed, but it is important to be mindful of clearly saying when you're dictating an impression or a diagnosis during that consultation. Do mention relevant terms, so clearly state the examinations you're performing, the body part involved, and the findings you observe. And summarize the patient statement. So restate key points of what the patient says to help Scribe structure the information accurately once you go to generate the note. Finally, after that consultation, select finish and create note. Pause and then review the note to ensure accuracy and completeness. So really, really useful and crucial, in fact, that the clinician, as I mentioned, is reviewing that note for accuracy and completeness. Add in any extra details, so adding that additional text into the note using the adjust feature that we just saw. Scribe is then going to place it under the appropriate heading. And then finally, save to record when you're ready to do so. And hopefully I'll be able to show you that in a moment. Apologies that didn't work during the demo. As I mentioned, a demo environment doesn't always work exactly as we hope. Finally, then, do remember that users must check that AI notes before taking any further action, and be aware that AI could miss or misinterpret the information. So just scribe responsibly is what I'm trying to say here. Moving us on then to safety and compliance. So I touched on this briefly earlier, but Accurate Scribe is safe, compliant, and assured. So it's integrated with Accuracy's privacy and security by design program, in line with NHS governance, data security, and clinical safety standards. So fully NHS compliant, as I mentioned. There is no link to the specific patient. It doesn't store audio, and it also doesn't use patient data to train the AI. We do have a few useful links that you can take a look at to kind of support you in getting started, one of which being a Getting Started with Scribe checklist, and then also FAQs that have been put together by our privacy and security team. So we can share those in the chat. We can also share those in the follow-up. Do take a look at those, because this is basically going to walk you through all those steps that you need to do from a governance point of view before getting started. When you're ready to get started, our team are here to support you. So there are loads of resources to help you start using Scribe once you have access. We have live daily training, on-demand learning resources via our implementation training hub, national webinars like this one. We also have one coming up next week, which I'm going to talk about in a second. Governance and compliance guidance that I've just mentioned. And then also you can access direct support by reaching out to our support or customer success team with any questions or troubleshooting you might have. Participating in training is a really important part of getting started with Scribe, and we are here to support you with whatever you might need. I mentioned QR codes. I'm now about to bombard you with some QR codes, so please have your phone ready to scan if you have one available. As I mentioned, if you're unable to scan for any reason, just let the team know and we'll send you the link. So you can access the training center via this QR code that is on the screen, which will allow you to kind of really unlock everything you need to confidently start using Accurate Scribe and embedding it into your day-to-day. So whether you're just getting started or really looking to maximize your use, the training center brings together all of the key resources in one place. So in there, we have things like interactive demos that allow you to walk through realistic scenarios and see Scribe in action, patient-facing materials to help you explain Scribe to patients clearly and confidently. Use this in your practice, put it up in the practice. A really useful one to just be able to start articulating that you're using this Scribe tool to your patients. A step-by-step user guide to help you get started. So following kind of really clear and practical guidance. Go live checklist. I've mentioned this, but just a simple checklist to ensure your team is fully ready from a compliance point of view. So support getting on top of that compliance piece, completing the DCB 0160 safety documentation and DPIA. We have all of this information available to you. Those privacy and security FAQs that I've mentioned, and then also support articles that could help with troubleshooting if needed. So please do scan that if you want access to our training centre. Just to kind of talk a little bit more about rollout, I'm sure you're probably very interested to hear when you might be getting access if you don't currently have access. So Scribe is now available to pilot. Please do join our waiting list for your chance to kind of get early access, and it is free access for the time being. So we're rolling out Accurate Scribe in a phased approach to practices that have signed up to our waiting list, and then national launch will commence from late June. Practices will be enrolled onto a 3-month free trial. And then following that, we'll be operating a tiered pricing model calculated per patient per year. Do note that there will always be a light version of the product available with 3 consultations per user per day. But for full access beyond the trial, please do reach out to our partnerships team at partnerships@accurix.com, and we'd be happy to walk you through those options. If somebody in the chat can just share that partnerships email address, that actually would be really helpful. Thank you. Another QR code, apologies, gone a bit QR code mad here, but we have another upcoming webinar. If you are interested in knowing more about kind of the clinical governance and regulatory insights, do join this session, which is happening next week. Apologies, it's not next week. We'll walk you through what Accurate Scribe is and how it works, and our approach to clinical safety, information governance, and medical device regulation. So you'll hear from our VP of Clinical, our Chief Information Security Officer, and also GP and Clinical IT Lead in North East London. We're also going to be covering on that one what implementation looks like in real practices, with time for questions throughout, as with this one. So please do join that one if you have any further questions about kind of clinical safety governance, and all of the above. Getting to the end of the QR codes, but final one, please do also join our community. So you're part of a GP community, which is fantastic. But you can join our GP community, where we have a Facebook page, various different WhatsApp channels where you can kind of join in discussions about what's happening throughout Accurx, network with colleagues, and then also view any upcoming in-person and virtual events as well. You can use these channels to share feedback, as I said, learn from peers, and really just help shape the future of Accurx. We've recently launched a WhatsApp group dedicated to Accurate Scribe. So if you want to kind of join that growing community and become a Scribe champion, please do feel free to add yourself to that WhatsApp channel. You can access it via this lovely QR code that's on screen here. And that is the end of me talking at you. We're going to now go to the Q&A. So your questions will be answered. Just bear with me while I basically have a little look. And between Faris and I, we will hopefully be able to answer those for you. I'm going to leave this up on screen. This is just to join the waiting list if you haven't managed to do that yet. So I think one for you, Faris, from Carol. Have you noticed impact on secretaries' workload so they can focus on other tasks?
So at the moment, it's just been GPs that have been using it, so nothing direct to admin teams. But that would be the next thing that we would look at, is whether there is any benefit for using the tool with admin teams. So probably not an immediate or direct benefit because they haven't been using it. But I think probably the perceived benefit would be that actually the referral letters could be done immediately. So the speed at which we can get that information over to admin teams to then send referrals is perhaps quicker, and that can make things more straightforward. But yeah, in terms of direct use, it's just been GPs who have been using it so far.
Thank you so much. Another one from Irvi. How does this compare to other AI tools on the market that you may have trialed?
Is that one for me, Kate?
Yeah, I mean, if you want to speak to that.
Yeah. Do you know what? So this is the only one that I've used or used in any significant way. I think probably this is for you guys at Accurx, but the most obvious benefit is going to be the integration with the toolbar. I think that's going to be, we're already very used to using Accurx as a means of communication and speeding up process. So the fact that it's integrated into the toolbar means this is, you know, much quicker, much more easy to access, I suppose. So from a user's perspective anyway, that's probably where the biggest benefit is. It's in having to not sign into other services and have it integrated into something that we use quite commonly.
Yeah, exactly. I'll just echo that in terms of, yeah, you being able to save to record, integration with your clinical system, and then utilize all of the other features that you have available to you on your toolbar, so that two-way messaging, and then also the use of Acumail for cross-care communication. Let me see what else we've got here. Do patients tend to feel self-conscious? Oh, I've lost the question. Bear with me. It's really flicking around here. Do patients tend to feel self-conscious knowing that what they are saying is being recorded in some way? I think you kind of briefly touched on this when you spoke about patient consent and that, yeah, their kind of feedback to it. If you could add any more to that.
Yeah, so number one, the recording isn't actually saved. So as the speech is happening, it's being transcribed into the text. So their verbal word, if you like, the auditory side of this is not actually saved. And do you know what? The feedback that we got, like when we're looking back at patient reports or patient feedback, they've often said were unaware that there was anything in the room. So I think for the patient, one of the good things actually, so no news is good news. They kind of just say, well, I didn't even notice, it was just fine. So I think patients, it hasn't changed patient behavior as far as I can see, and they haven't been any more uncomfortable with having it, and nobody's fed that back in terms of patient feedback. So no, I don't think people feel in any way more conscious that they've got a microphone in the room. People soon forget that.
Nice. Thank you so much for sharing that. Yeah, just as Faris said, it's not picking up that recording. It's purely just transcribing the conversation. And as we saw in that brief demo, you can always flick back and see the transcription. And yeah, within that, there's no audio stored. So you can be confident in the fact that it's not picking up and recording the kind of clinical conversation that you are having. You can also go back and just see any of those previous consultations as well if you need to see the history. But again, no audio stored there. What else have we got here? Does it record telephone conversations? So yes, this can be used for both face-to-face and telephone conversations. Yeah, works very well with both. So yeah, do feel free to kind of test that out once you have access. And yeah, you'll also be able to, as I mentioned, utilize this on your mobile phone very soon as well. Another question, does it reduce aggression for patients who usually shout? Have you needed to use a zero tolerance letters based on Scribe? I'm not sure whether you have any experience with that, Faris, at all so far in your use.
Not yet.
No.
I might feedback if that does arise. No, I mean it was so rare, isn't it, that you'll get a patient that's like that. So I've not come across that at all. I suppose being theoretical about how it could work. I suppose some people can feel angry, like a patient can feel quite frustrated in a consultation if they think you're not listening, and where communication breaks down, patients do get angry either in the consultation or they complain, and most complaints are about communication. So actually you could theorize and say, if this is working in the background, you're more likely to be able to be present with that patient, pick up on the non-verbal cues. They will get the feeling that you're listening to them, and that may be something that's going to reduce complaints or problems. So theoretically, I think it might help, but not yet experienced many very angry patients.
Glad to hear it. That's very good to know. I think I saw one just around the percentage of hallucinations. So the tool is around 94% accurate. Sorry, I've lost the question entirely. Sorry, 96% accurate with about a 4% kind of, inaccuracy there, which is, industry standard. I hope that helps answer your question. I think I saw one about a GP demo, patient demo for us to see it in action. Saldo, there was a kind of a brief demo that we showed. You will receive this in the follow-up as well. So once you have that via email, you will have this recording, and we can also share with you the implementation training hub where you can see heaps of demos in there, which is kind of broken down by all of different parts of the functionality. What else have we got in here? Chat is really going to town, flicking up and down. Doesn't seem to want to mark as done. Bear with me if there are any further ones for you. Faris?
I can see there's one here which says our examination findings like oxygen sats, respiratory rate, blood pressure, temp correctly entered EMIS, or do they appear as free text? So I can chip in and say that they are SNOMED coded. I think there's some observation codes which are SNOMED coded in the scribe, so that when you transfer those over, they will come up as a SNOMED code. So a fully coded observation. So that's quite helpful.
Yes, very helpful. And there will be further developments to that down the line coming. So at the moment, the observations are available to SNOMED code into the record, but we will be kind of rolling this out to have further SNOMED coding and support with things like QoF, hopefully coming over the next couple of months. Faris, one for you. Do you have patient survey data yet, or any health outcome data?
Patient survey data, yes. We've got some patients data so far, and the data, it's really interesting. And I think I wouldn't say that you're going to turn this on and it's going to transform patient experience tomorrow. But I think the signs that we've had is the areas where there's definite improvement is in patients understanding what the management plan was. So I think that was really strong. So most patients, I think 90% of patients strongly agreed that they understood what the management plan was when Scribe was used. And that number was much closer to 60% when Scribe wasn't used. So I think that's definitely safe to say. In terms of the GP being present in the consultation, some signs of improvement there. We already had quite a high baseline for that, but definitely the scores were higher when the Scribe was used. So yes, we are getting some of that data through now, which is starting to look really, really interesting. But the biggest two gains, if I was to identify them, would be number one is GP time saved. Actually, I'll give you three. Number one, GP time saved. Number two, reduce stress felt by the clinician when they use the Scribe. So their stress around their clinic was reduced quite significantly when they did use the Scribe. And number three was patients' understanding of the management plan. Those were probably the three big hitters.
Thank you so much. Faris, seems to be a lot coming for it for you. What was your experience in getting DPIA agreement with your ICB before kind of getting started?
Sure. So we actually upskilled within the practice to do this work. So we as a practice have upskilled so we can do the DPIAs as an organization. We in the practice have someone able to be a digital clinical safety officer. So we can as a practice do that work in-house. But I do know that lots of ICBs have signed off DPIAs on behalf of their practices for this work. So I think, to be honest, what you'll find, Accurx have got a lot of that already. So the work around this from that perspective has already been done. So if you do have any concerns with that, if you speak to Accurx, all the due diligence work, you should be able to identify that through speaking to them.
Amazing. Thank you so much. Yeah, and kind of as Faris just mentioned, those documents that we have and the support articles that we have that can really just help handhold through that process. Do get in touch with our team if you do need any further support on that.
Kate, I've got a brilliant one here.
Yeah, go on.
One that flashed up that said essentially along the lines of, because of this, will people in admin start losing their jobs? Which is always the thing. Will AI start taking over people's jobs? And do you know what? As a GP partner who spent quite a bit of time looking at these things, I'd say no, not at all. What's brilliant about these AI tools is, can they relinquish us of the stuff that we don't necessarily need to do or don't enjoy doing? So can it take that away so that we can free up our staff to do the stuff that really adds impact? So the work that we've done is, actually, let's take some of this work away from admin or GPs, the stuff that can be done through AI and other means, and then let's free up that time so people can just live a better quality of life and a better working experience, but also let's redistribute some of that time into doing things that are much more useful. So from an admin time, ours is about shifting people from doing mundane work into letting them do more proactive care around patients with the highest needs. So good question, but I think it's not about what's replacing us. It's about how are we being freed up to do the stuff where we can add maximum value.
Amazing. Thank you so much for sharing that one. I've seen one just around demonstrating production of a referral letter from a note. So yes, absolutely. I will just reshare my full screen and come back to Tandem, Accurate Scribe powered by Tandem, where we can see our notes that we created earlier. So I mentioned some downstream documentation. You can do so really quickly and easily from within that note. So we have the information that was created during that consultation. And what you can do is just click to create other notes here and then select from a drop down of other documents that you might want to create. So we have here a GP patient letter, request for advice and guidance. You can generate an SMS message if you wanted to, and that will give you a template to then share with your patient post-consultation. If I click into this specialist referral letter here, then you can see the structure that's now going to give me that I can then copy and utilize elsewhere. So you might then want to use this, as I've mentioned, for that cross-care communication piece, utilize AccuMail that you have access to on your toolbar via the @ symbol to then share this referral with somebody outside of your organization. Other documents, as I mentioned, if you wanted to then kind of follow up with your patient via an SMS, then you can do so. And we're just going to get a really brief message to share then via that two-way messaging functionality that you have available to you. Any final questions? Appreciate we've just hit 1 o'clock. So yeah, if I'll just see if there are any others that we can answer live. If not, then we will try and do just a bit of a kind of summary of any of the others that have come through. Appreciate we haven't managed to get to all of them today, but thank you so much for all of them. It's been really, really great to hear all of the feedback, and the questions that are coming through will really kind of help change the way that we are able to support you over the coming weeks as we roll this out nationally. Huge thank you, Faris, for joining us today. Really, really great to hear your journey and your experience with using Scribe tools and Accurate Scribe so far. And yeah, if there aren't any further points, then do feel free to drop off. As I mentioned, I will be sharing a recording plus that piece that we missed at the beginning in a follow-up afterwards. So do expect that in the next couple of days with some further resources. And you should all be getting access to Scribe soon. So do keep in touch if you have any further feedback or need any further support. We are very much here to help you in getting started. Thank you all for joining.